According to the ASPCA, there are between 70 and 80 million dogs and between 74 and 96 million cats owned in the United States. Americans spent $15.73 billion on veterinary care in 2015. Americans want the best vet care for their pets and expect 5 key things from the veterinary team. Ask the right questions. Listen to their concerns. Inform them about the best ways to provide care. Respect their decisions. And to be a partner in their patient's care. The only way these expectations can be met is with dialogue, with communication. Veterinary patients cannot speak for themselves. The patient, the pet, relies on the communication between the veterinary team and the owner. The overall patient care will be dramatically impacted if there is a breakdown in the communication. Dr. Laura Garrett of the Department of Veterinary Clinical Medicine at the College of Veterinary Medicine at the University of Illinois asserts that there are 4 things that the veterinary team must do to ensure good patient communication. Watch the nonverbal communication. Part of any conversation is done without speaking a word. Watch how the patient's owner is speaking or how they are standing. The veterinary team can learn a lot from the nonverbal cues. Be empathetic. The veterinary team will do well to put themselves in their client's owner's shoes, so to speak. You must show that you empathize, or the client won't know you understand. The patient's owner wants you to see them as a person, someone that loves their animal, not just some paying customer. Animals evoke many emotions in people, and the veterinary team can use empathy to help filter through the emotions and get to the root of the medical problem. Get the patient's owner to engage. Ask open-ended questions to get the conversation going. This is a great opportunity to watch the nonverbal communication too. Start the questions off with who, what, did, rather than why. Why can make the client feel like there is blame to be had. Open-ended questions will provide more than a yes or no response from the owner. Actively listen. Listen and repeat what the patient's owner has said. Rephrase so the owner knows that you have in fact been listening. This will also confirm that you have actually understood what has been said. This can help build a rapport with the patient's owner and allow for an even better flow of communication. There are opportunities within the dialogue to learn more about the patient and its owner's concerns. This is of the utmost importance when aiming to treat or diagnose a patient that can't answer the questions themselves. Patient care also depends on written communication. These come in the way of annual reminder cards or emails that are sent to the patient's owners, informing them that a particular shot is due or a life-saving test needs to be performed. These reminder cards or emails are usually fairly generic and may just mention the pet's name and which shot or test is due, but they do bring the patients into the door, allowing for preventative care. A recent survey on social media showed that 78% of clients will make the appointment based on the reminder card. When it is time for the veterinary team to communicate amongst themselves, most veterinary offices rely on notes. Of the 3 animal hospitals surveyed, 2 relied on software programs used for documentation and tracking, and 1 used handwritten documentation. All notes, weights, patient histories, and diagnosis are entered into the program and used to help treat the patient at the more modern offices. The small-town veterinary practice used handwritten notes on patient cards that were filed in an index system. All communication between the veterinary team and the clients are imperative to the health and well-being of the patients. The outcome of patient care relies on the dialogue between the client and the team in order to successfully diagnose and/or treat the animal. Following the 4 guidelines of veterinary communication set by Dr. Laura Garrett will allow for great patient care and establishing rapport with the owner.